Welcome back guys. Now in this video let's discuss about acute leukemias. So acute leukemias. So you know it, acute leukemias are the cancer of blood. Usually we call it as the blood cancer, right? So here what exactly do we mean by acute leukemias? In order to understand this, first let's recap the normal hematopoiesis process, the flow chart of the normal hematopoiesis. You already know it, but let's do it in a quick time. Hematopoietic stem cell, there is a hematopoietic stem cell which is CD34 positive. This hematopoietic stem cell is going to divide into myeloid blasts. Okay, myeloid stem cell, you can also call it as a myeloid blast and lymphoid blast. Okay, now this myeloid blast is going to further divide into erythroblast, myeloblast, monoblast and megakaryoblast. Okay, now from this erythroblast we are going to have the mature cells, that is the RBC. The myeloblast is going to produce the granulocytes, which includes the neutrophils, okay, the neutrophils, basophils as well as eosinophils. Okay, these are the mature cells. Monoblast is going to give rise to monocytes and megakaryoblast are going to give rise to the megakaryocytes, which are nothing but the platelets. Now already we have discussed that the myeloid blast is going to divide into two types. Oh, see, this not myeloid blast, the lymphoblast. Okay, the lymphoid blast or the lymphoblast can be of B lymphoblast, okay, B lymphoblast or T lymphoblast. It can divide into B lymphoblast and T lymphoblasts. These B lymphoblasts are going to form the B cells, which on activation becomes plasma cells. The plasma cells are the ones which produce the antibodies. The T lymphoblasts are going to form the T cells, that is CD4 positive T helper cells and CD8 positive T cytotoxic cells. So CD4 positive, CD8 positive T cells, okay, T lymphocytes. So we have the B lymphocytes, we have the T lymphocytes, which are coming from the lymphoid blast or the lymphoid lineage. So there are two lineages, which is a myeloid lineage as well as a lymphoid lineage, right? Now what exactly is acute leukemias? See, acute leukemias are the problems of which cells? Acute leukemias are the problems of blasts. It's the problems of the blasts. Okay, so blastic cells. So these blastic cells are proliferating so much. Okay, so let me highlight here. See, whatever I have highlighted here, all these are the immature cells. The blastic cells are proliferating too much. There is a neoplastic proliferation of the blasts. Immature cells are getting crowded in the blood. Too much amount of cells are getting crowded in the blood. Which cells? Immature cells. Which immature cells? All these are the WBCs. Okay, so acute leukemias are the neoplastic proliferation of the blasts. So let me write here. Acute, there is nothing cute about acute leukemias, which are bad things, right? These are the cancers, acute leukemias. So what exactly are they? They are neoplastic proliferation of blasts. They are defined as the neoplastic proliferation of blast. Now you can ask me, sir, how much blast? For example, I have seen this number of blasts in the blood or this number of blasts in the bone marrow. So can I call it as acute leukemias? See, to define it as a acute leukemia, yes, there is a neoplastic proliferation of blast, but how much? More than 20% of the bone marrow. Okay, see, it's a neoplastic proliferation of the blasts are defined as more than 20% blasts, immature cells in bone marrow. Okay, more than 20% of the blasts seen inside the bone marrow. So you have taken the bone marrow biopsy, and in the bone marrow biopsy, if you see out of all the cells, if you see more than 20% blasts, then you can say this is acute leukemia. Crowding of blasts, everywhere there is a blast. Okay, now what's the problem, sir, if you ask me? See, the entire bone marrow is getting crowded because of this blast, crowded out. So what's the problem? See, more number of cells is there. That's good, right? No, that's definitely not good, because the blasts are going to totally occupy the bone marrow. So the normal function, the physiologic function of the bone marrow is going to be compromised. So the patient is going to suffer with anemia, because the normal functions are getting, the normal function is now not happening because of this blast. Okay, so anemia is going to be there. This anemia is going to cause the fatigue. Anemia is going to cause the fatigue. Easy fatigability is going to be seen in the females or the males. Okay, or the patient is going to have neutropenia, or you can say leukopenia. Anemia, leukopenia. So why leukopenia or neutropenia can be seen? Because total blast, everywhere there is a blast. The blasts are not the mature cells, they are the immature cells. So this leukopenia, or you can say the neutropenia, is the one which is going to cause recurrent infections. Next, there can be thrombocytopenia. So thrombocytopenia means the platelets are going down. As the platelets are going down, the patient is going to have bleeding. Okay, bleeding disorders, the bleeding into the skin, bleeding into the joints, kind of thing. So at the end of the day, the point which I want you to know is acute leukemia is the main problem. The totally bone marrow is crowded out with this immature cells which are blast. More than how much? More than 20%. That's an MCQ. Because of the accumulation of this blast, the normal production of RBC, WBC platelets is going to be hampered, which is going to cause anemia or bleeding disorders or recurrent infections. So in a one word, I can say there is pancytopenia. Okay, there is pancytopenia. Pan means all, cytopenia. Cytopenias are going to be seen, okay, in acute leukemias. Now, the next point which I want you to know is classification. Okay, acute leukemias are classified into how many types? Now, just look at this image. Okay, just look at this image and tell me. See, how many types of blasts are there? There are two types of blasts. There is myeloid blast and lymphoid blast. So, acute leukemias are divided into acute myeloid leukemias or acute myelogenous leukemias, acute lymphoid leukemias or lymphoblastic leukemias. So, there are two types of acute leukemias. Two types. What are they? One is AML, acute myelogenous leukemia. There are different types of AML, that's a totally different thing. But broadly classifying, there are AML, acute myeloblastic leukemia or acute myelogenous leukemia, where the myeloid blasts are proliferating so much. There is more than 20% accumulation of the myeloid blasts. And there can be ALL, acute lymphoblastic leukemia. Okay, so always the one point which I want you to know, acute means blasts, acute means immature cells. Okay, so myeloblasts, lymphoblast, acute myelogenous, you can say acute myelogenous leukemia or acute myeloblastic leukemia, acute lymphoblastic leukemia. Okay, so how to differentiate between them? Okay, that we will discuss like in the upcoming slides. We can discuss about that. First, let's begin with the acute lymphoblastic leukemia. Okay, ALL. So let's begin with this. Acute lymphoblastic leukemia. Now my question to you, sir, what exactly is acute lymphoblastic leukemia? You should know. Acute lymphoblastic leukemia means more than 20% of the blast. Which blasts? Lymphoblasts in the bone marrow. There is more than 20% of the lymphoblasts. Okay. So let me write here, neoplastic proliferation of lymphoblast, where in bone marrow. Okay. So now my question is, how to differentiate, how to say this is a lymphoblast, this is not a myeloblast, this is a lymphoblast. How can we say? See, acute leukemias can be of two types. There can be acute myeloblastic leukemia or acute lymphoblastic leukemia. How to say this is a lymphoblast, this is not a myeloblast, this is a lymphoblast? How to say? See, these lymphoblasts are positive for something called as TDT. The TDT positive will be seen. Okay, DDT, it's a DNA polymerase. a DNA polymerase, TDT stands for terminal deoxytransferase. Okay, terminal deoxytransferase, which is a DNA polymerase which is present specifically in the lymphoblast, not in the myeloid blast. Okay, not in the myeloblast, it's not present. It's not even present in the mature T lymphocytes. Okay, it's not present in mature T lymphocytes or B lymphocytes. In mature cells, it's not there. It's present in the lymphoblast. That's it. So TDT positivity is going to be seen. Now, my question to you is, sir, this ALL, okay, acute lymphoblastic leukemia. In which people we will see this ALL? This ALL is most commonly seen in children. Okay, it's going to be most commonly seen in children. That too, most commonly seen in children with Down syndrome. Okay, so that too after 5 years. Before 5 years, the Down's patients are at a risk of getting a different type of WBC cancer, a different type of cancer which is called as a megakaryoblast leukemia. That's a total different thing. Now, my point is, Down syndrome patients, Down's babies, before 5 years of age, they will get a different type of acute leukemia. After 5 years, they are at a more risk of getting ALL, that is acute lymphoblastic leukemia. Okay. Now, sir, look at this flowchart once. Look at this flowchart. Right now I am discussing about ALL, that is acute, which is a blast, acute lymphoblastic leukemia. My question to you, how many types of lymphoblasts are there? Lymphoblasts or lymphoid blasts, how many types of lymphoblasts are there? There is a B lymphoblast which will give rise to the B cells, and there is a T lymphoblast which will give rise to the T cells. Okay, CD4 positive and CD8 positive T cells. So how many types of ALL is possible? So ALL can be also of two types. ALL can be of BALL, simply called as a ball, and TALL, simply called as a tall. So B means B type, it's a B lymphoblast. BALL means B acute lymphoblastic leukemia. TALL means T acute lymphoblastic leukemia. Now simple. Sir, what is BALL? Now imagine there is a baby who is having BALL. Okay, there is a baby who is having a BALL. BALL means, if we say that this fellow is having a BALL, which means it's a neoplastic proliferation of, okay, neoplastic proliferation and accumulation of, neoplastic accumulation of B lymphoblast, neoplastic accumulation of which cells? B lymphoblast in bone marrow. Which these cells, the B lymphoblast, it's a lymphoblast, right? So definitely it is TDT positive. It's a TDT, it's going to be TDT positive. Okay. Now what is a TALL, sir? TALL is also same thing. It's a neoplastic accumulation. It's a neoplastic accumulation of T lymphoblast in bone marrow. Okay, which are also, these T lymphoblasts are also TDT positive. They are also TDT positive. So at the end of the day, the point which I want you to know is, sir, ALL is of two types. ALL is most commonly seen in the children, okay, in the Down's babies. But ALL is of two types. What are the two types of ALL? BALL hai and TALL hai. Okay, B acute lymphoblastic leukemia, T acute lymphoblastic leukemia. My question is, sir, we can differentiate acute lymphoblastic leukemias from acute myeloid leukemias. Okay, acute myeloid leukemias and acute lymphoblastic leukemias we can differentiate based on the TDT positivity. If a blast is having TDT, definitely we can say this is a lymphoblast. But how to differentiate between BALL and TALL? How to differentiate whether the blast is B cell or whether it's a T lymphoblast? B lymphoblast or T lymphoblast? How to differentiate? Say B lymphoblasts are having different types of surface markers. T lymphoblasts are having different types of surface markers. Now on B lymphoblasts, if it is a BALL, okay, B lymphoblasts are going to have certain CD markers, especially on B. What do you have is CD10 positivity, cluster designation CD10 will be there, CD19 as well as CD20. If it is BALL, these things will be there. BALL children, these the blasts, okay, the blasts are going to show CD10, CD19 and CD20 positivity. If it is a TALL, Okay, if it's a TALL, on TALL there will be positivity from CD2 to CD8 positivity is going to be seen, anywhere between CD2, 3, 4, 5, 6, 7, 8, something like that. Okay, so these markers are going to be seen. So BALL is differentiated from TALL based on the surface markers. Okay, now important points about the BALL. Let me write here BALL. That is B, acute lymphoblastic leukemia. So it's the most common type of ALL. Okay, it's the most common type of ALL. Don't forget, what are the two types of ALL? Ball and tall. BALL and TALL. Out of two, what is most common? BALL is most common. Okay. Now, it is having a very good prognosis when compared to the other good prognosis. The prognosis thing is based on different cytogenetic mutation that we will discuss. But the BALL, most common type of ALL. Okay. So, the cells are going to express, this BALL cells are going to express, here itself let me write, are going to express TDT positivity is going to be seen, as well as markers, that is CD 10, 19 and 20 positivity is going to be seen. Now I have said you the prognosis is usually good, but the prognosis is based on cytogenetic abnormalities. See, if a person, okay, if there is a boy who is having this BALL because of a mutation or of a translocation, see, for example, translocation 1221, okay, 1221, if this is the translocation that is there, okay, if this is the translocation that is there, that's going to have the good prognosis. 1221 translocation is going to show good prognosis, and this is usually seen in the children. If the translocation is 922 translocation 922, usually this translocation 922 is going to result in a chromosome, okay, translocation between the 9 and 22 chromosomes, okay, that's going to cause a Philadelphia chromosome. Philadelphia chromosome, which is usually seen with the CML type of cancer, chronic myelogenous leukemia. Is a total different type of cancer. We will discuss in the chronic leukemias. If a patient is having 922 translocation, which is usually seen with the CML, but that's okay. Now, if this translocation is there, it can also cause BALL. It can also lead to BALL, but the prognosis is going to be bad prognosis. Okay. So, prognosis is dependent on the cytogenetic abnormality. Both translocation 1221 and translocation 922 can both lead to the BALL, but translocation 1221 is going to have the good prognosis. Translocation 922, which is resulting in the Philadelphia chromosome, is going to have the bad prognosis. Okay, but if the patient is having this type, good prognosis, is going to have a very excellent response to the chemotherapy. Okay, excellent response to chemotherapy. Excellent response to the chemotherapy. But important point is this BALL cells, okay, they will go into the testis, they will go into the central nervous system, whatever. So whatever the chemotherapy you are giving, see, it's a blood cancer, right? The blasts are there, blasts, immature cells are going to come into the bloodstream, so everywhere there is blast. So these blastic cells, we have to target these blastic cells and we have to kill these blastic cells. We know the WBC, they have a propensity to go into the tissues, okay, they have a capability to enter into the tissues. So these blasts also can enter into the meninges, can enter into the brain, they can enter into the scrotum. So whatever the chemotherapy you are giving, that chemotherapy is going to kill only the blasts which are there in the blood. So you have to do something which can cross the blood-brain barrier, and you have to do something which can cross the blood testicular barrier. So the point which I want you to know is we have to do the prophylactic, okay, prophylactic chemotherapy should be done. So important point, prophylaxis. To scrotum and central nervous system, okay. So prophylaxis should be done to the scrotum as well as the cerebrospinal fluid. We have to inject something which can cross this so that the patient won't develop the recurrence of this cancer in the future, okay. So this is an important point which I want you to know. Now BALL is completed. Okay, first type of acute lymphoblastic leukemia, that is BALL, is completed. Now let's discuss about TALL. Now tell me, what exactly is TALL? So, ALL, acute lymphoblastic leukemia. Which lymphoblast, sir? It's a T lymphoblast. So, this T lymphoblasts are accumulating inside the bone marrow more than how much percent? More than 20% in the bone marrow. Now, what they will do? They will crowd out the bone marrow, which is going to lead to the pancytopenias. Like anemia can be seen, neutropenia can be seen, and thrombocytopenia can be seen. You know it. You know all the stuff. But how can we say that this is a TALL? This is TAL. Sir, the cells are going to be TDD positivity. They will show TDD positivity. Also, these cells are going to show the positivity for the marker CD2 to CD8 positivity. These cells will have positivity for CD2 to CD8. Okay, CD2 to CD8 positivity. Important point is, this is going to especially affect the teenagers. Okay, T for, I used to remember like T for teenagers. Okay, so T cells, we know it. T cells will go to the thymus. Okay, for maturation, for the process of maturation, T cells will go to the thymus. The education of the T cells is happening in the thymus. So, all these blasts will go into the thymus and there they will start to proliferate. So, if you look at the thymus, thymus is going to become big. So, there will be thymic mass. Teenagers are going to present with a mediastinal mass at the thymic mass. Okay, thymoma. Okay, thymic mass. So, whenever this cells, whenever they are forming a solid mass, a solid lump. Okay, before BALL, it's all like a liquid. The cancer, which is it's a liquid tumor. Okay, but whenever these cancerous cells, okay, the WBC, whenever these blastic cells, immature cells, whenever they are forming a mass kind of thing, then you have to call it as lymphoma. So TALL, you can also call it as a lymphoma. Okay, so now I'm going to call it as T acute lymphoblastic lymphoma. It's not a leukemia. Leukemia is a liquid cancer. Okay, liquid. The cancer cells which are present in the bone marrow and the immature cells which are freely circulating in the blood. But when it is forming a mass, you have to call it as acute lymphoblastic lymphoma. Okay, acute lymphoblastic lymphoma, because it's forming a thymic mass. Now, what else you have to know? See, I have already discussed all the important points. BALL acute leukemias are of two types. Acute leukemias, especially the acute lymphoblastic leukemias. Okay, acute lymphoblastic leukemias are of two types. One is BALL and TALL. How to differentiate between them? All the lymphoblasts are going to express that TDD positivity. And how to differentiate between BALL and TALL? BALL is going to be differentiated from TALL based on the surface markers. And one thing, this TALL, see, T cells do not express, very important, do not express at any time, do not express CD10. CD10 is of B cells. Here I have explained you CD10, it is going to be seen on B cells. Okay, it's never going to be seen on the T lymphoblast. Okay guys, now we have completed the acute lymphoblastic leukemias. Now in the next video, we'll be mainly concentrating on the acute myeloid leukemias or acute myeloblastic leukemias. Hope the video is helpful. Thank you.